So good day, mom and sir. Now po is i-perform ko naman po is removing a nasogastric tube. So the purpose of this assessment is to provide as much comfort as possible for the patients and to prevent complications. For the equipment issue, 50 ml syringe, optional po non-sterile gloves, additional PPE po as indicated. So stethoscope, disposable plastic bag, towel or disposable pad, abnormal saline solutions for irrigation and MC spacing. So for the assessment po is perform an abdominal assessment for inspecting presence of distension po. Next po i-auscultate po natin for the bowel and sound. And lastly is for palpating the abdomen for firmness or the tenderness. Naman mo masakit, sir? Okay po. Thank you. So, after po nun is also assess the output from the NG tube, noting the amount of the color and the consistency. Okay. And next is, let's proceed na po tayo sa procedure. Check the medical order for the removal of the NG tube. So, dito po, check po natin. Okay, after po ma-check, so this is to ensure the correct implementations of the physician's order. And next is perform hand hygiene and put on PPE as indicated po. So hand hygiene po is to prevent any microorganism. And also po PPE po is required based on the transmissions precaution. And after nun is, now po is patient yung procedure na gagawin. So, ang step 1 po is tatanggalin na po natin yung NDT reducer. Lahat po ng gagawin is sasabihin ko naman po i-instruct ko po kayo. Okay na po ba sa inyo? At sabihin niyo po kung may naman po kayo ng anything pagkatapos po ng gawin.
Okay.
Thank you po. So, patient's cooperation is facilitated when explanations are provided. Due to changes in patient's conditions, assessment is vital before the initiating intervention. And after that po is pull the patient's bedside curtains and also raise the bed based the comfortable working positions. Usually po in the elbow height ng nurse. And also po, i-assist po si patients into the 30 to 45 degree positions. Sir? Then after po nun is, mag-replace po ako ng towel or disposable pad po dito po sa may chest ni patients. And also, kailangan din po natin magbigay ng tissue and emesis basin po sa patients. So, the rationale of this po is provide for the privacy po and also appropriate working height facilities po, comforts and proper body mechanics for the nurse po para ma-prevent po yung mga back pain, ganun, sa nag-assist po kay patients. And also towel or pad protects patients from the contact from the gastric secretion po. And also the emesis basin po is helpful So, emesis basin naman po is helpful if the patient is vomits or gags. The tissue po are necessary if the patient wants to blow po sa kanyang nose when tube po is removed. And after naman po doon is put on gloves. Put on gloves po. And discontinued suction separates the tube from the suctions and pin tube from the patient's gown and carefully remove the adhesive tape from the patient's nose. So grabs prevents contact blood and the body fluids po and disconnecting from the suctions, and the patient's allows of is unnecessary removal. And next po is check the placement of the attached syringe flush with 10 ml of the water normal saline solution po, optional po, or clear with 30 to 50 ml. And air of saline solutions clears to tube secretion speeding or the debris. So, next po is, ito po, ikaklamp na po yung tube with the fingers and doubling the tube itself. Instruct the patient to take deep breath and hold it. Quickly and carefully remove the tube while the patient is holding breath po. So, tatanggalin ko na po. Hinga pong malalim ha. Malalim. Tapos po, ito po, i-dispose po natin itong tube. Depende po sa policy ng hospital po. And after po nun, is remove gloves. And place po sa bag and perform hand hygiene. This is to prevent any microorganism po. And next is, offer po natin si patients ng mouth care and facial tissues to blow them up, to blow or lower the bed and assist the patients to a position comfort as needed po. Sir? This intervention po is promote the patient's comfort and remove equipment and raise the sidewalls and lower bed pots, promotes the patient's comfort and safety. Okay, and after po nun is put on gloves and measure sa amount of the nasal drainage in the collections device and to record po, subtract and irrigant the fluid if necessary po. So, irrigations fluid po is consider the intake to obtain the nasogastric drainage is irrigant fluid amounts are subtracted from the total of nasogastric drainage. So, yun po. And after nan is remove any additional PPE po if used and perform hand hygiene. So, removing the PPE is reduced for the risk for the infection and infections in transmissions on contamination of the other item, and hand hygiene is to prevent the transmission of the microorganism. And also, lastly po is documents the procedure. That's all po. Thank you.